Welcome to the American Academy of Orthotists and Prosthetists 2021 virtual meeting. My name is Nelson Lamarquand. I'm a licensed and certified orthotist with Allerg USA and clinical support specialist. This is an introduction to the SWASH Steady and Go orthosis. We're going to discuss my over 20 years of fitting the SWASH orthosis and our experience in fitting the orthosis, who the candidates are for the SWASH orthosis, the biomechanics, and the benefits and application of the SWASH. We're going to go over a little bit about cerebral palsy, as that's who the SWASH orthosis was initially designed for, the biomechanics of the SWASH orthosis, indications and contraindications, the benefits of the SWASH, and an introduction to assembly and fitting of the SWASH orthosis. Cerebral palsy is a huge patient population with significant hip displacement issues secondary to high hip adductor tone. It's especially true in the non-ambulatory patient population. Patients with CP usually have one or more of the following. They're unable to sit independently, they have poor hip development, they have difficulty in standing, and difficulty in walking resulting in scissor gait. High adductor tone is one of the most common and obvious symptoms of spastic cerebral palsy. This tone affects posture of the entire body. It drives the feet into pronation, internally rotates the lower extremities, and has a flexion influence on both the knees and the hips. This lower extremity posture influences the trunk into a slouch posture that is typical of children with cerebral palsy. We can see the impact of high adductor tone on the trunk. It results into a slouch posture, there's trunk flexion, and there's cervical hyperextension. Standing and walking without any orthotic intervention results in very poor positioning of the feet, knees, and hips. During ambulation, the result is scissor gait, and these kids expend a lot of energy just to ambulate. And because they're using so much energy, they're only able to walk short distances. SWASH is an acronym for sitting, walking, and standing hip orthosis. It is, again, a variable abduction orthosis. Also think of it as an adductor blocker. The goals for the treatment of cerebral palsy are to provide a stable base of support, to provide correction of deformities, to facilitate training skills so the kids can participate in their ADLs, and to improve efficiency during gait. Some of our treatment goals should be for a more erect, relaxed positioning of the trunk, stabilize the hips, better positioning of the lower extremities, improve coordination, lower energy consumption, and increase the distance walked. Some of the indications for the SWASH orthosis are spastic diplegia, spastic quadriplegia, those at risk for hip dysfunction, spina bifida, post-op bracing, nocturnal splinting, or post-Botox treatment. Some of the contraindications are dislocated hips, hip flexion contractures greater than 20 degrees, strong adductor tone, excessive tibial torsion, and depending on where their backlift and pump is placed at pump location. Again, SWASH is sitting, walking, and standing hip orthosis. Little history about SWASH. It was actually invented back in the 1980s by an optician for his daughter with cerebral palsy. It's been on the market since 1996. I began my experience with SWASH in 1997. The benefits of improved posture and hip alignment cannot be overemphasized. Tone reduction is often seen in conjunction with the SWASH orthosis. For those of you that are familiar with the SWASH orthosis, we used to carry the classic and the low profile. Well, we've totally redesigned and improved both of those models, and we'd like to introduce the new versions of the SWASH to you at this time. The new SWASH Steady replaces the original classic. And the Go replaces the low profile. So what are the improvements and changes we made to the SWASH? Well, all of the uprights are 8 millimeters thick, with the exception of the SWASH Steady in a size 1, because that's still designed for non-ambulatory usage and early intervention. All of the components are interchangeable, so that reduces inventory. 8 millimeter uprights are stronger. We've improved the cosmesis, and the new buckles make for easier donning and doffing. With the Steady and the Go, we have the same positive functional outcome. Both have a low-profile joint assembly, and both have interchangeable componentry, again with the exception of the Steady in a size 1. Some of the benefits of the new Steady and Go are quick lock buckles on the abdominal pad and thigh cups, riveted straps on the hip section, same type of pelvic pad for both models. New low-profile joint assemblies gives more space. The new 8mm uprights manage heavier forces and deal with higher adductor tone. We have the ability now to change model and size with the same type of uprights, and there is no snaps that can pop open. Easier to don and doff with quick lock buckles. There's the same closing mechanism in both the steady and the go, and with the new material, it's much easier to clean. The steady is designed for patients that need more help with trunk stability. Overall tone improvement and muscle control is evident, but may not carry over to more independent gait. Tone reduction in sitting is a huge benefit that provides benefits to many patients. Please take a look at this young lady's facial expression and sitting in her seating system. Please note that she does have a pommel. There are straps to keep her feet positioned correctly. She's got a harness that basically forces her into her seating system. And just look how uncomfortable she looks. With the introduction of the SWASH orthosis, we can see she's much more relaxed. You can eliminate the positioning straps, you can get rid of the pommel, and just look at the difference in her facial expression and how much more happy she looks in her seating system. Again, this is primarily a non-ambulatory child. Children with CP also have a very unstable balance while sitting. The SWASH actually creates a stable tripod base of support, giving these kids hands for their ADLs, and they can participate. They don't have to use their hands to hold on and sit. Please note in this picture, the child is wearing a classic, which would be replaced with a steady. But you can just see the difference in his face. He can just focus on relaxing instead of just trying to balance so he doesn't fall over. It's really incredible to see in your initial fittings. The SWASH Go is designed for children that are ambulatory and have a stable trunk. It prevents scissoring by getting the proper separation at the knees and the feet, allowing them to ambulate greater distances. So this is again for the child that is ambulatory. Now we're going to talk a little bit about the biomechanics of the SWASH orthosis. The SWASH is designed to work in all three planes of motion: frontal, sagittal, and the transverse plane. The benefits of improved posture and hip alignment cannot be overemphasized. Tone reduction is often seen in conjunction with the SWASH orthosis. It truly is a unique orthosis with a very unique joint assembly. It works on all three planes to allow for more flexion, more external rotation, and more abduction. And again, it is designed for sitting, walking, and standing. The joint forms the movement of an oval, so during walking, the orthosis follows the long arc of the oval. Our goal should be just about an inch of separation at the knees during gait. The SWASH orthosis actually overcomes high adductor tone and repositions the femoral head into a more neutral position into the acetabulum. Hip bracing and fixed abduction and flexion, or even fixed abduction and variable flexion, even though successful, might further deprive the joint of positive influences of movement and weight bearing, and hard-won motor achievements may be lost. There is a place for fixed abduction orthosis, but the prices might be loss of function. Our patient goals with using the SWASH orthosis should be independent sitting, ambulation without scissor gait, improved trunk posture, independent sit to stand, and stretching of those adductors. You can see what our expectations are by the chart below with the proper fitting and wearing of the SWASH Steady and Go. With both models, we have improved hip alignment. We most often have improvement in posture, function, and decreasing of the hip internal rotation, but there really is no impact on femoral antiversion or tibial torsion. So when do we start using the SWASH orthosis? Of course, early intervention is ideal. If we can get children between the ages of 9 months old and 2 years old, that would be great, because they easily adapt to the orthosis. It does not interfere with crawling. It assists them with learning to stand. It assists them with learning to walk. It assists them with learning to sit. Most often it would be the steady in a size 1, because we are looking at non-ambulatory usage here, and because of the size of the child, that steady in a size 1 would probably be ideal. Of course, we can also fit children that are 2 to 6 years old, because they're still young enough that they can easily adapt to the orthosis as well. It helps them stand, assist them to walk, and also assist them with sitting and the ability to use their hands to participate in their ADLs. Older children, say 6 to 12 years old, are a little slower to adapt to the use of the SWASH orthosis. That's primarily because they're more self-conscious and more aware of orthotic intervention and sometimes a little bit resistance to orthotic intervention. But they're definitely still candidates to try the SWASH orthosis on. The adult patient can definitely present us with some challenges when fitting the SWASH orthosis. That's due to their fixed gait pattern, their size, their muscle strength. But the adult truly does appreciate the increased independence and the functional outcomes that the orthosis provides. SWASH orthosis definitely helps to improve ambulation as it helps to control scissor gait. There is lots of non-ambulatory use for the SWASH orthosis as well. In my opinion, the stable tripod base of support that the SWASH creates during sitting is one of the biggest benefits of the orthosis. That's because it allows the individual to use their hands to participate in their ADLs and to not have to worry about their using their hands to control their balance so they don't fall over. Since we're changing posture, stance, and gait with the SWASH orthosis, if the individual is wearing any ankle-foot orthosis, those AFOs might have to be reevaluated because of all the changes we made to posture, stance, and gait. In regards to rehab and physical therapy, occupational therapy, and speech therapy, the SWASH is truly a universal therapy tool to be used across all modalities. You might wonder, you can figure out that PT, it helps to prevent scissor gait and walking. OT, it gives the sitting balance. But one of the best sayings I've ever heard from a speech therapist was stabilize the hips and free up the lips. Since SWASH truly stabilizes the hip, it can help with speech, breathing, as well as digestion. SWASH is really, to me, a multi-versatile therapy tool. Some of the precautions when we look at for fitting are short muscle structures, tight hamstrings, any spinal deformities, but sometimes the SWASH can be incorporated into an LSO or a TLSO, as many practitioners have done, and continued evaluation. By continued evaluation, I mean if we have those patients that sometimes are not consistently showing up for their appointments, for therapy, for O&P services, so they truly need to be evaluated. Even if we have the perfect SWASH candidate as far as diagnosis go, if we have a non-compliant or a family that is not reliable, then we really need to look at the whole situation if it is the right orthosis for them. So when do we use the steady, and then when do we use the go? Who is the right candidate for each of the orthosis? The indications for the SWASH steady would be when we're looking to achieve maximum trunk control. It is designed primarily for non-ambulatory usage. The size 1 uprights are smaller for early intervention, and it also provides greater pelvic and torso coverage. So that really hugs the child to give them that trunk control that we're looking to achieve. The pelvic band of the SWASH steady has an abdominal pad with quick lock buckles. The pelvic band extends from L2, L3 to the distal margin of the sacrum, and the cover is removable and washable. The uprights are 6 millimeters on the size 1. Again, that's for early intervention, non-ambulatory usage. 8 millimeter uprights are on the size 2, 3, and 4 for older children. The thigh cuffs also have the quick lock buckles. Size 2 through 4 cuffs are all interchangeable. And again, the covers on the thigh cuffs are removable and washable. Indications for the SWASH Go orthosis would be prevention of scissor gait during ambulation, also to facilitate better gait with the use of the posterior walkers, and when there's limited space between the iliac crest and the rib cage. Features of the SWASH Go orthosis are the pelvic band has a malleable metal posterior frame, the abdominal pad has the quick lock buckles, and the cover is removable and washable. The uprights on sizes 1 through 6 of the SWASH Go are all 8 millimeters in diameter to address that high adductor zone and to prevent scissoring during gait. Please note, if longer uprights are needed for a larger waist size, again, that size 6 pelvic band of the SWASH accommodates between a 34 and a 36-inch waist, we can get longer uprights for you as well to deal with taller, older patients. In regards to the thigh cuffs, the cuffs are also interchangeable for all sizes. They have an easy overlap cuff closure, and the covers are also removable and washable on the SWASH Go. The The pelvic section of the GO is fitted above the ASIS when we're looking to achieve a little bit of a spinal flexion influence. We fit the pelvic section at the pelvic notch when we want to minimize that flexion influence, or we're looking to create more anterior space to accommodate those baclofen fin pumps. There are three primary measurements we need to pick the right size orthosis. While supine, we get a pelvic circumference, a thigh circumference, and I like to choose distal thigh. You'll hear sometimes mid-thigh being talked about, but I like nice long lever arms, and I always go with a distal thigh measurement. We get an upright length from the natural waist to the mid-patella on the lateral aspect of the leg. And those, again, are your three primary measurements. What's nice about it, again, is all of the componentry of the SWASH Steady and Go are all interchangeable. The uprights on the SWASH are either available in 123 degrees for a nice wide sitting base or 115 degrees, which provides a narrower sitting base. I have primarily always started off using the 115 degree uprights. 123 provide too much stretch. Maybe if the patient is getting reevaluated for a new SWASH, we might try the 123 degree uprights to see if they can tolerate that much stretch. But primarily I have always utilized the 115 degree uprights. This is where a virtual presentation can present its challenges. I like this part to be very hands-on. But unfortunately, we can't do that at this time. But there is a manual for fitting and assembling of the SWASH orthosis that is available through your allied district managers. The retaining rings come attached to the uprights, and the uprights are marked left and right. We remove the retaining ring from the upright. We put it inside the assembly, the joint assembly in the posterior section. We then slide the upright through the retaining ring and tighten it down. Here you can see that the upright is marked right, size 6, 115 degrees. The blue line is just to use as a reference point when you're doing the adjustment height of the cuffs to make sure they're symmetrical on both sides. Again, our fitting is done while the child is supine. We put on the pelvic section first. And this is something that should be comfortably snug. We do not have to overly tighten it. Again, we want to be able to maybe get a finger or two underneath the abdominal pad to make sure it is not too tight. Thigh cuffs are fit as distal as possible, as I had mentioned earlier in the presentation. And to make sure I have no impingement at the popliteal fossa, I slightly flex the leg. Check to make sure that the pelvic section is fitted comfortably snug and everything is symmetrical. And we check that waistband to make sure everything is secure. You can see how I can get my fingers right behind the abdominal pad to make sure I'm not causing too much pressure. We also want to check the height of the pelvic band distally to make sure there's clearance, that there's no digging into any seating surfaces that might be utilized. We're looking at about 1 or 2 inches of clearance distally from the posterior distal section of the pelvic band to the seating surface. We also want to make sure that the straps on both sides are symmetrical and that there's no impingement on any soft tissue. We also want to ensure that the upright is not impinging on the leg whatsoever or impinging upon the hip. If the upright is impinging upon the leg, we have to slide it out. And to do this, we have to go to the joint assembly, go to the retaining ring, loosen the set screw in the center of the retaining ring, and slide the upright out. And then to retighten it, and vice versa. If it's too wide, if the upright's too far from the leg, we have to loosen the set screw and slide it in. So the width adjustment for the upright is all done in the joint assembly by loosening that set screw and sliding the upright either further into the orthosis or into the joint assembly, or sliding it out of the joint assembly. SWASH is a variable abduction orthosis, but I also like to think of it as an adductor blocker. I do my benchmark settings that when I start off manually adducting the orthosis, I have 1 inch of separation at the cuffs. I then put it on the child and I watch them ambulate. If I now have about 3 inches of separation at the knees as they're ambulating, I know I need to give them less resistance, that I've provided too much resistance. If we look at the right-hand side of the screen, you'll see to get less resistance, you loosen the set screws in the joint assemblies and you rotate them downwards. That provides us with less resistance. If I put it on the different child and that 1 inch of separation I have, The child is still scissoring, I need to provide more resistance to that child. So I go back to the joint assembly. I look at the left-hand side of the screen. I see I would rotate the joint assemblies upward. So upward provides you with more resistance. Downward provides you with less resistance. The thigh cuffs are conical in shape. So you slide them onto the uprights with the wider part at the top. You also can do some fine tuning by rotating the cuffs on the uprights to bring the legs in or out a little bit further. And it's where the fine tuning is done. You want to make sure you have clearance that the bars aren't hitting a chair either. So again, rotating the cuffs either inward or outward would help with these adjustments. Just try to do it as symmetrical as possible. The quick lock buckles make it easy to don and doff. And once again, we flex at the knee to make sure that there's no impingement at the popliteal fossa and that the cuffs are in the right position. We hope you have enjoyed this introduction to the SWASH Steady and Go. If you are interested in becoming certified to fit these to your patients, the next step is to take the online course. There is no charge to take the course, and it is approved by 4 CEUs. You can go to www.aladusa.com and click on the Education tab and scroll down to SWASH. You will be able to view the fitting manual. The clinical manual is also available as a PDF, or we can get you hard copies through your ALA district manager. You'll also be able to view the SWASH sizing guide. Please note once again that the components are all interchangeable: the uprights, the pelvic section, and the thigh cuffs, with again the exception of the Steady and the size 1. That has the 6mm uprights in a different joint assembly, and again is designed for early intervention usage. Thank you very much for attending the introduction to the SWASH Steady and Go. Please don't hesitate contacting us if you need further information or assistance. My contact information is on the screen. Thank you again. Have a great day. Stay safe.